You an update on the fate of mentally ill persons at the Pantang Psychiatric, or the condition of those there who are mentally unstable could deteriorate as a strike by the hospital staff enters day 2. The Pantang Psychiatric Hospital may not just be battling with encroachers for lands belonging to the hospital. There's also another hurdle of getting resources to finance the operations. Acting Director of the hospital, Frank Benning, has revealed that the hospital has not received any funding from government in the past 3 years. Speaking on the Super Morning Show with Kojo Youngson, Dr. Benning also revealed that the hospital presented a budget of 8 million cedis, but is yet to receive any money from government.
We have a major challenge with financing mental health care. And the issue is that the law says the service is free. Okay. So in that sense, then somebody has to provide all the funding we need for the service. And who else will provide for it besides government or an insurance system? And here we are, insurance doesn't cover mental health care in this country. Even private insurance, they don't cover it. Okay? And then we're not receiving money from government as well. So what happens is that people who come to access the service, we take a token from them compared to what may be charged at the regional hospital or in the teaching hospitals. I call it a token. For example, 15 cedis for consultation, when I have access healthcare in Kolebu for about 65 cedis. You see? So that is what it is. We take something, it's woefully inadequate. And why we take that is to make sure that the service doesn't completely break down. Okay. But then the even bigger challenge is the fact that we have close to 100 people who are with us all the time. And they become a burden for us more or less, in the sense that we have to feed them 3 times a day. We need to take care of the environment. We need to buy medicines for them. And if they have physical health problems, we need to send them to Ridge or Kolebu. And we have to, a hospital has to pay for that for them. And we are saying that I think if that is allowed to continue, then somewhere along the line, the service will break down completely. Government needs to find a lasting solution for mental health financing. There should be a sustainable policy intervention where mental health service or care is prepaid. I mean, you just walk in, you have needs, and then you access service. We shouldn't forget that these people are some of the poorest, most vulnerable in our societies. Okay? You see them on the streets, homeless, and it looks like the numbers are going up. It's because the hospitals haven't been resourced to be able to take good care of them. Okay? For example, you come to the hospital now, and I'm not in a hurry to bring in another person, because what is happening is that when I'll bring the person in, and I can't give the person quality care, I'll bring the person in, and it means that I have to go back to suppliers and beg them to give me more. In so doing, increasing the already existing debt. I remember one time there's this guy who was brought from the streets into the hospital, and I went close to him and he said, so I should let him go home. And I was like, oh, no, I mean, stay with us. We want to take care of you and things. And he goes like, well, I was being fed better on the streets than what you're feeding me here. And, you know, it shouldn't be the case.
That's interesting. So how much debt are you saddled with right now?
Just over 3 million Ghana cedis.
3 million Ghana cedis. That's a period of, are you able to tell us the period?
I think late 2013.
Okay.
Late 2013. I must say that it was more than that. But in 2016, the ministry gave us about 1 million cedis to offset some of the debt. That's how come it's come down to over 3.
We are also hearing that you submitted a budget of 8 million Ghana cedis to the ministry, actually, and you got just 100,000 Ghana cedis after the budget.
Well, the ceiling for goods and services is 133,000 Ghana cedis, and even then, we haven't received it yet. Well, what can you say? What can you do? You go to your father that this is what you need genuinely, and your father takes a look at it and says, I'm going to give you this. And you know very well that it's not going to be able to cater for your needs. What do? You struggle with it. You do what you can. So when you come and you don't receive the best of care, when you come and the quality of care is poor, then you should understand that it's because we are not resourced adequately to be able to give you the best.
So So how much did you submit as a budget?
Something in the range of, and that's a tricky question as well. Okay. You do your real budget and you're looking at maybe something over 8 million, and you take it back and you say, no, you need to draw a budget to fit into your IGF, that is your internal generated fund. Okay, so if I'm able to generate 2 million, it means all my operations must fit into the 2 million. And it's not easy for a mental health service, especially when you have these people who are always there who don't pay anything.
You supposed to meet the minister yesterday. Are you able to tell us what happened at a particular meeting?
We didn't meet the presence of the minister. So we haven't been able to meet with the minister yet.
Okay. So what is happening with the strike, regarding the strike?
I am appealing to my staff to go back to work, and I'm doing everything I can